Have you ever found yourself super bored or tired during a lecture, but you still have to memorize everything for all of the examinations that are coming up? Or have you found yourself spending hours studying for tests but still unable to do well? I found myself in these situations numerous times throughout medical school. These are feelings that are so common. Hello YouTube friends, welcome to my YouTube channel. My name is Lena. I'm a second year medical student in the United States. In this video, I'll be talking about 4 strategies that I use to help me study and ace medical school. I hope these strategies will help you ace the subject that you are having some trouble with. First one is, what do you do with the boring lectures? Sometimes when I listen to the pre-recorded lectures, you just see the professors reading over the slides and they are so boring that I find myself unable to process anything. Instead, what I do is I copy and paste the objectives of those lectures, usually like 5 to 10 objectives per lecture, into a document. I find my answers to the objectives myself. For example, if one of the objectives is describe the process of homeostasis, instead of listening to the lecture and not really retaining anything about this concept, I would try to actively find the answer to this objective by myself. I would probably go on YouTube and type in homeostasis and watch some videos, or I could just simply look it up online or using different outside resources that are helpful for me to learn the concept. The objective is the key. The way that you obtain the information or answer to that objective should be done through a process of active learning. Instead of watching those boring lectures, you might just be able to go to the slides and find the answer yourself. Slides don't work or they still don't help you completely comprehend the concept, go online and search up a YouTube video or two to truly understand what it is. The purpose is to integrate it into your knowledge base, but the way of getting to it needs to be an active process, and you decide what this active process is. Again, get the objectives down from that boring lecture. Find the information pertaining to that objective actively. You are processing the information actively, and this really helps to actively retain the information that you need to know. Second thing is to create flashcards for all of the concepts that you learn. And this includes the objectives, the key concepts, also the keywords. Try to make these flashcards into your own language, so it's integrated into your own knowledge base instead of purely memorizing the words attached to that flashcard. Review these flashcards on a daily basis. Anki is a flashcard system that a lot of medical students love to use, but there's definitely a lot of different applications or software websites that you could use to create your own flashcard. Quizlet is a great example. Find out the flashcard system that works for you. For subjects that require a lot of memorization, definitely flashcards are the way to go. Third thing is to create concept maps. Like I mentioned earlier, active recall is definitely the key to learning. Actively thinking about the information and trying to recall it yourself is better than trying to passively read the notes or passively copy down certain diagram in the textbook. For creating concept maps, the keyword is create. It's not copy. Copying concept maps from a textbook is a passive way of memorizing information. You're simply seeing something and you're drawing it out. Instead, close that textbook and try to actively recall the whole concept yourself based on your own memorization and understanding of these concepts. You are trying to create this mental map and connecting all the pieces of information together. It's very tempting to open that textbook again so you just get all of the answers at once, but the more you force yourself to extract the little pieces of information from your brain, you'll see that you actually memorize more than you think. And after you're completely done, you think you exhausted all of the little pieces of information in your brain. That is the time to pull up the textbook, open it up, and check how you did. Did you connect all of the concepts correctly? Did you miss anything in detail? And then use the textbook as a resource to fill in the gap. For example, the renin-angiotensin system in the body does a lot. Help to elevate blood pressure, it constricts all of the vessels, acting on a lot of different organs. So instead of copying the diagram from the textbook, I would close the textbook, write down renin-angiotensin system, and think about the organs that it influences and write down what what it does to these organs. I most likely missed one or two things, but that's okay because I actively recalled some of it and focused my memory on these two things that I missed when creating the concept map. And last but not the least, if you are preparing for an exam, focus on practice questions. Whether this is a midterm, whether it's a final, the MCAT, GRE, you might find it a little bit frustrating because you feel like you don't know the content 100% yet, and so you don't feel ready to jump into practice questions. But as a matter of fact, you don't need to know 100% of the knowledge. When I was studying for the MCAT, make sure I memorized every little detail in the Kaplan books. However, I feel like I wasted a lot of time on that. I should have started practice questions first. This applies to any other subject that you're learning, and especially in medical school. Practice questions will help you learn how the questions are framed, how you could best extract the information from the prompt, and then find the correct answer through process of elimination or through identifying certain keywords in the answer option. When you are preparing for a test, it might be very tempting to try to review the content over and over again, the PowerPoint slides over and over. However, it's more efficient to focus your time on the practice question from what the professor provided, from the question bank, or tests that were written from previous years. After I find myself doing more practice questions, I find myself using time more efficiently and doing better on examinations as well as quizzes. So these are the 4 strategies that help me ace the medical school exams with the least amount of time spent for preparation, despite the boring lectures, despite the difficulty to pay attention sometimes, and difficulty of memorizing some of the concepts. So are there any other strategies that I missed in this video? Please comment down below if you resonate with some of the strategies shared above, or if you have some strategies that you would like to share with other people. Thank you so much for watching this video. Please give it a thumbs up if you find it helpful. Subscribe for more content about medical school, how to study in medical school, and my vlogs in medical school. Follow our Instagram, Manlena, for more. I will definitely see you next time.